Hi, good afternoon, everybody. This is Eric with American Business Systems. Want to greet each and every one of you as you're coming into the webinar this afternoon. We've got a lot of information in a Q&A session between Patrick and me this afternoon. Again, my name is Eric Auger. I am here to help guide you and co-host this webinar this afternoon with you. And again, feel free if you got any questions for Patrick and or me, please be able to do that. We are actually going to talk a little bit more in depth about the performance of our system this afternoon and how it's going to help benefit you as you build your business in medical billing. So that's the iClaim and the EMRX platform, and share some brand new news with you about that as well. When you go through our training, when you get through with everything that you need to go through with the training, you're going to get a certificate and you're going to be certified as a certified medical revenue manager. That's what you're going to need, because a lot of people are asking, well, why would a doctor even want to talk with me when I've just kind of gone through training? Well, they never know when you've gone through training, but plus you've got our entire support, the 28 years of support that you've gotten from ABS. We're here to help you right along the way. Speaking of that 28 years, over 30 years ago, Linda and Patrick Phillips started doing medical billing themselves. It's always good to know that you're getting into business with somebody that's actually done something in the business that you're in. Over the last 15 years that I've been with Patrick and Adam, we've come across franchises and talked with those folks, and we've asked them, well, have you ever done this? And they've never sold that product, or they've never done that product or that service. Well, that's not so here at American Business Systems. We're very much involved, and we support and help out with people because, again, we've been there. Patrick is a prolific author. He's a writer. He is also a podcaster at sometimes. He loves to, but more importantly, what he likes to do is talk with you individually. So those that are on the webinar today, you haven't had a chat with just Patrick. I bet you if you get with your rep that you're working with here at American Business Systems, I bet you they can arrange a phone call with Patrick if you want to talk with him directly. But again, here are some of the books that he's helped write and co-author. One that is very important, I think, is one of the smaller ones, but it's How to Reprogram Yourself for Success. And we spoke a little bit about that last time we were together in our last webinar. Then Patrick also has given over the reins to Adam Phillips, and he is now the CEO of American Business Systems. But what you're looking at here is an article that Adam got published there. And not only has Adam got this published, but he's got a book out too. And you're going to want to be able to get a hold of that book. And I think we might even be able to find that in the webinar today. But also, Patrick is one of the co-founders of MERMA, which is the Medical Revenue Management Association of America, which is also the group of people that actually does the certification for you to become a certified medical revenue manager. All right, folks. So today we're going to get started. As you can see, the hands are going up there in this little box here, right here, which means that not only are the questions that we're going to be going through, we want to see your questions over here in the Q&A. So please feel free to do that. So look, without any further ado, I'm going to ask Patrick to join me via the video camera here. And here he comes, and make sure he's not on mute. Let's make sure you're not on mute.
Hey, that's a good tip to give me.
Just, I'm learning. I'm a little slow too, Hey, we're both getting old guys.
Yeah, I tend to put that mic has a button on it that has a red light. And when you push that, it starts flashing. You'd think that would call my attention to it, that it's on mute, but I forget that sometimes. Well, thanks for joining us today, folks. You're going to learn a lot about our business and some of the questions that were asked here at ABS about the business. But remember, this is for you too. It's live. Those of you who are watching it today on Wednesday, 4 p.m. Central Time. So that means you can type in your questions right now. We will see them right here on the screen as you type, and can answer them by just typing you a reply, or we'll answer it live, but we won't mention your name, maybe your first name, but we won't give it away who you are, where you are, or anything like that. So your privacy is assured.
So Patrick, I know we're going to be going through a lot of Q&As, a lot of live Q&As, a lot of questions that have come in from other people. But I have a question for you, and one that's probably really good for these folks. They may have never heard that, but kind of tell us how you and Linda got started, even getting involved in medical billing.
We had a friend who actually owned a durable medical equipment company. He rented hospital beds and oxygen, wheelchairs, that kind of thing. And he was billing Medicare for that. Well, just being friends with this couple, we just basically knew each other from church. And basically, he just called us up one day and said, Linda, can you do medical billing? She said, well, no, I don't know what that is. He said, well, come into my office and I'll show you. Well, when she gets there, of course, he has a typewriter. Yes, a manual typewriter. And she was typing out on some multi-part form, filling it out. Anyway, after a couple of days, it's not brain surgery. She learned how to do it pretty quick, filled out the forms. You have to fold them up, stick them in an envelope, put a stamp on there and mail them and hope that the insurance company says they got them.
Absolutely. Patrick, I even thought about that. I thought, can you still even buy a typewriter? I think I need to show my grandchildren how we learned to actually type.
You can. Yes, I bought one just to show my grandkids, and they go,
yeah, well, whatever.
Yeah, so I sold it. But to them, it was old technology.
Yeah. So Patrick, also tell us about the award that you guys got at the end of last year through this franchise directory or a dictionary.
Well, this company basically publishes this magazine and picks out of all the, there's thousands, I guess, of franchises out there and business opportunities. And out of those, the top 100 get awarded as what they call game changers. So for 2021, we're amongst that top 100. We're proud of that. Yeah.
That's an awesome award. So thanks for sharing that. Again, we're reminding you, go over to your Q&A box and open that up. Get ready to type in some of your questions. And so Patrick, here we go with the first question. I think we've got 10 questions that we're going to go through this afternoon. Let's first talk about how much does it cost to start and operate an ABS business. I'm going to kick that slide over so you can talk, because there's some other things we want to talk about the cost.
Yeah, right there on our website, if you go to absystems.com, you'll see that we have a whole little section there on what's included in the package. And as you can see right there in the first paragraph, we tell people that there is a one-time all-inclusive investment of $28,990. So let's round that to $29,000. It's kind of like Walmart, everything's ends in 97 cents. So we rounded that up to $29,000. But folks, that's because it's still one of the few business opportunities and franchises you'll find that's under $30,000. Right. And for that, it is a one-time all-inclusive. Now, Eric, that means no one who joins us and goes through our training ever has to pay for any support or extra user seats or updates to the software or the codes.
Right.
And there's companies out there who do something similar to what we do, teach people how to do this, but they charge another $1,200 a year for support after the first year or two. So we just don't believe in nickel and diming people to death. You can continue paying for that support for the rest of your life and end up paying thousands of more dollars. And we just decided not to do that. So we make a few pennies off all the transaction, as you know, Eric, and that means on the back end, we have revenue coming in that covers our support costs. And that's why we can support people forever.
Absolutely. And then, Patrick, what about ongoing fees? What about any ongoing fees? Are there any ongoing fees? Are there any franchise fees? Any
None
revenue sharing fees?
Nope. In fact, I would tell people to do this. If you ask your ABS rep, we'll send you a list of licensees, people who've gone through our training and are now business owners. And you can call some of them up and just ask them any question you want, including that one. Have you ever paid anything? What else do you have to pay, to ABS after that initial fee? And you'll find out there's nothing. In 28 years, we have not charged anything after people pay that initial fee. And that's all we ask. Yeah.
Absolutely.
So it's like a franchise fee. If you go look at the franchises, folks, $29,000 is not much money compared to most of the franchises out there.
That is true. And so if there's no royalty fees or franchise fees or anything else like that, that's a great deal. Now, Patrick, I know that with some people want to maybe do some extra marketing and they may want to invest in a little bit more. they're not just tied to not being able to do that, correct? I mean, I think you've even coached a couple of licensees. I think some people have put up videos and they've done some extra things like that, or they've joined like a BNI group. So those are fees and things that obviously are really up to the business owner at that point.
Yes, and since folks, since you start your own business, and we'll teach you how to get all that set up, by the way, if you don't know how to do that, we'll show you how to name your business, how to register it with your state. All the details are included in our training as to how to get your business up and running. But the point is, you'll be using your company name, not ABS's. And
Right.
anything that's outside of what we would provide you, like hosting of a website and some advertising costs and things like that, of course, Eric, those are the extra costs that somebody might have in running this business. We're assuming that you have a computer, a cell phone, and built into the computer, you have the ability to get electronic faxes, and you can scan things in. If you don't have a scanner, for example, that'd be the only other piece of equipment that some people might not have that I would recommend you get. Some people have that built into their printer too.
Yeah, especially when you're starting to do billing. I mean, you're going to want to scan in some things. There's some things you're going to have to do. So hopefully that helped answer your questions on that. Again, let me remind, I think Lourdes, you came in a little bit later, but good to see you. But reminding everybody again, if you got any particular questions, especially about cost, now's a good time for you to ask Patrick and or me, and we'll help answer any of those questions here. And even if it comes up in your mind in a little bit, go ahead and put that in there. If we've got the time, we'll come back over and we'll talk about that with you.
Yeah, I see a few others that dropped in here just kind of late. Brian, thank you. Chitty, Lords, and Todd. So,
yep. Okay, so another question people often ask, Patrick, do I need to have prior billing or sales experience to be successful?
You know, the one thing I would tell people, if you have a background in sales or marketing, is to be very, very careful, to listen very carefully as to how we teach people to go out and market to doctors. Because Eric, it's a whole different world out there selling things to doctors. They're not very open. So we know how to get past the gatekeeper. We know how to get things into the hands of the doctor, to engage with the doctor. We know how to help you meet people in your community that can introduce you to the doctor. And that's why you don't need any. In fact, Eric, I've told people that have been struggling, some of them call up 3 months later and say, hey, still haven't got a client. And when I start asking them what they've been doing, they're not following our system at all. They think, well, you know, I've been in sales, I know what's best. And so they've tried their own things and have failed miserably in getting a client. Then once we commit them to following our program and our plan, some of them will tell you, if you talk to them, they'll say, you know what, I just followed their plan and it worked. I don't know why it worked, but it did.
It just worked. Well, that's on the sales experience side. Now let's talk about the billing side. And I know, hopefully I'm reading some people's minds here. They're probably already thinking about the billing and possibly the coding aspect of it. I'm going to put up this next slide for us to really kind of pinpoint who's responsible for providing medical codes, and that it's the doctor's responsibility.
Yeah, the buck stops there. And if the doctor doesn't know the code, of course, they could always hire a coder, or they can work through you, because we have certified medical coders that will help you help the doctor decide what is the best code. Because, you know, Eric, people don't know this, but if a doctor bills for a particular visit, one particular code, it might mean that the doctor saw the patient for 15 minutes when they really saw him for closer to 30 minutes. Well, that should be a different code, right? And that's why they're losing money and leaving money on the table. A good medical doctor has access to medical coders that can help him with that. And we've got a service that can help with that, of course, called CodeRight.
That's correct. That's correct. And then we're actually going to show you a little bit, basically, how easy it is to do medical billing. You can actually we can kind of even show it to you if you haven't seen a demo of the system, but really what happens whenever you get to medical billing, what it is, it's just basically taking the information that the doctor's given you, even those codes, and putting them into a system, and then filing those claims through our iClaim system. Now, there are some systems out there that can be a little bit more difficult because, as Patrick, as you and I already know, our systems already have the latest, most up-to-date billing codes that are needed to actually do the billing.
And that's one reason a lot of claims are rejected by Medicare and insurance companies, is because the doctor didn't use the correct code, and the insurance company knows that. So they'll just stamp it rejected and send it back. Then the people in the office, of course, have to take the time to go back and find out what was wrong and what's the right code and send it in. This is why our system, Eric, is so superior to all the others out there, because with our built-in clearinghouse, we just don't have those rejections. Well, we do, but they're less than 2%, when most doctors are seeing a 20 to 30% rejection rate on their initial claim submission.
Absolutely. Then I even like this: as you grow, how often have we seen our certified medical revenue managers actually hire people who have actually gone to school to be a coder and or a biller?
Yeah, it's amazing how many people out there have taken courses and then they never went on to actually get a job in a doctor's office, or for some reason they didn't want to start their own business and didn't know how. So you're right, Eric, we have licensees in our network. That's the great part about being a part of our network, isn't it? Is that these licensees have access to all the other people in our network, and they can correspond with those people through our Facebook page, our LinkedIn page, our Myrma page. They can connect with those people and hire the people they need. In fact, Eric, we've had licensees hire other licensees who that licensee loves to do the data entry, but they don't like to do the upfront sales part. And yet this licensee says, I know how to go out and get clients. I'll just bring all the clients. You do the billing, we'll split it, and we're both making money.
Exactly. We've actually seen that.
Yeah.
Looks like we've got another person that joined us. Tony, good to see you. Thank you for joining us this afternoon. Again, let me remind everybody about the question box. But okay, great. We've got a question in here. Let's see if we can read this. If providers ask us to use their claim submission software instead of ABS's software, do we accept such contracts? That's a great question, Patrick. You want to take a first shot at answering that? And I'll even add my 2 cents to that.
Yeah. So what they're asking is that if a doctor already has a claim submission software, which most of them do, if they're submitting claims in their own office, they have it. Then they are asking. Let me see. I got to go find that question.
I think I just popped it over there. Just look under the answered one.
Okay. Yeah. Anyway, so they can use their own software. Now, the real advantages to our system and what our licensees can do for doctors lies in our iClaim EMRX system. I won't fool you there. It doesn't mean you couldn't do the billing. Many licensees have said, yes, I'll do the billing using your software, and they just jump in there. They're all real similar, so it's pretty easy to use software with a connection to their computer. And then after you've filed a few claims, and maybe the claims are being rejected a few, just like they would be through their own system anyway, you tell them, look, I've got a new system here. So you always have a foot in the door, so to speak, with our other services and with our software to go in and show the doctor somewhere down the line why they should switch over. And many times that happens.
Absolutely. That's what I was going to add to it. You'll actually see, we're going to share a little bit about what Patrick just talked to you about. Let's move on to some more questions here. How much money can I make with a medical billing business? Now, Patrick, I know on our new website, there should be a spot there that does the calculation on how you can put in 1 or 2 or 3 or 4 or 5 different providers in the system. We have put in the number 5 here to do what's called the income potential. And you can see there that we've averaged out the number of patients a doctor may see in a day. Now, folks, that's pretty low. 20 patients a day is pretty low. Average clinic will see anywhere from 30 to 40 patients a day, especially during high peak seasons, like maybe during the wintertime or so. But you're going to see that. And so you can see our numbers are pretty low, and the average claim is right around $100 per claim. What you would be charging that doctor to do that billing is about 7%. Now, when we click on submit here, you're going to see, and I'm going to kind of draw this back to your investment here of $28,990. Remember, your investment of $28,990 could get you to this type of number, and that's $273,000 a year servicing 5 offices. Now, Patrick, is that even possible? Can people get to 5 offices?
Well, I laugh at that, Eric, because you know that there are licensees that we have that have 15, 20, 30, 40, 50,
Yes.
yes, even over 100 medical providers that they're providing services for. So, yes, this is, I would say, very realistic.
Yes. And you can see that your monthly income at that point is 22,748. Now, that's not the beginning. We understand that. Typically, if you just get to one doctor a year, I mean, if you got one doctor your first year. And Patrick, let's kind of talk about this. Let's really kind of talk shop here, because you and I've been in business and as entrepreneurs for a really, really long time. You and I've tried so many different things. Some things worked really great. Some things were a flop, but we've all learned that the rule of thumb, if a business is going to make it, it's going to make it within its first 2 years.
Right.
And what that means is that you're going to get your first getting into the black part of your business. You're no longer in the red of your business.
Right.
So, I mean, if we think about it, if you get a doctor the first year, typically that's an income about $35,000 to $40,000 a year with one doctor. If you think about your return on investment of $28,000, $29,000 with your first year potentially at least getting in the black the first year, that's pretty good speed there.
Yeah, going from red ink to black ink, that's the goal of every business that starts
Yes.
out. And most of them, like you said, don't reach the black ink on their ledgers, the profit, until after a couple of years. So we've got licensees who, again, if you talk to some of them, you'll hear them say on their interviews with me that they made that back within 6, 9 months, sometimes a year.
Yeah.
That's pretty good. Yeah.
And if you're doing it within the first 2 years, folks, you're still within the norm. So we're not trying to scare you that it's going to take you 2 years to get your first doctor. But again, if you're doing what we tell you to do, remember, if you've got a sales background, you try to go do it on your own the way that you like to do it, it might take you a little bit longer, because we're going to ask the question, how do I get clients? Here we go, Patrick. How do I get clients here?
Well, here's the thing people need to think about, Eric. As you're seeing there on the screen, folks, there are a lot of different services that we've come up with over the years that you can offer to doctors. Now, they're all optional. You don't have to offer any of these, except, well, one of them, you got to do one of them to make money, right? But you don't have to do any of them unless you want to. And when you do, that opens up doors to you to talk to doctors about all kinds of things. Maybe the doctor is interested in knowing more about coding. And do you have somebody that can help him with coding? Well, you can start talking to him about CodeWrite immediately.
Right.
Yeah.
Yeah. If the doctor asks you, do you do coding? You say, absolutely, I do. You may even run into a dentist. You got down here a DentaMatch. You've got some, you can actually do dental billing. If you want to help the doctor with virtual care is a pretty hot thing, and we didn't talking about it today, but let me explain that to you. Obviously, everybody is understanding that we're coming out of a pandemic, and during that time, the doctors still needed to keep up with their patients that couldn't get into their office. Well, what's a way that you can do that? Well, and that's through virtual care. And virtual care means remote patient monitoring. So a doctor could remotely monitor their patients either with a blood pressure cuff or a glucometer or a pulse oximeter, and kind of keep up with that patient. And if there is a out of bounds reading, well, that doctor's notified immediately. And ABS actually has that in their package book. There is not any other medical billing company billing opportunity that I know of that actually has that as part of their package. And that's all inclusive of that $28,990, plus all of the marketing material that you get here with ABS. Patrick, what is it, over 22,000 pieces, including books?
Yes. In fact, Eric, when the topic here is how do I get clients? Let me just say this. Because of all those other ancillary services that you have, you will get clients that other medical billing companies in your area will not be able to get, because they can't offer all of these different things that you see here. And you can. And the great thing is that you can offer any one of these. You'll make some money on them, not big dollars, but I mean enough to make it worth your while. And then you got your foot in the door, right? Your friends, you're on the inside track, right, with the doctor and the office manager. And you can always talk to them about other services like the billing itself. Eric, I can't tell you how many licensees I've talked to that said, I started out with one of these services, and then the doctor later on switched and let me started doing their billing through our system, because I got in the doctor's office. I got to show them through a demo, usually, how far advanced our system is, and they loved it.
Yes, absolutely. Absolutely. You know, let's keep moving on here. And you're still asking, how do you get clients? And folks, you got to remember, we don't talk about this much anymore because of MIRMA, but through MIRMA and American Business System, you're actually going to be part of the nation's largest group of independent medical billers in the nation. Because there is no other group and organization that has that many there. And plus, you've got all these folks here that are part of your coaching team. Now, along with that, one of the things that we've learned in marketing is, how do we get you in front of the doctor? And one of the ways to get you in front of the doctor is that they hear from another physician. Patrick, you want to kind of talk about that as I kind of lead into these next couple of slides here?
Yeah, and one of the things that we have done is we've come up with a partner, Dr. Vicki Ragnar, who's been in this industry helping people connect with doctors like financial planners and so forth. She's been helping that for the last 10 years. Eric, she was a general surgeon, as you know, saw many thousands of patients over the years. Her and a partner opened up a clinic, and they were going to run this themselves. And then they had this lady who was doing the billing. They found out later she had committed Medicare fraud. So
Right.
they had to let her go. And the doctor, her partner's wife, said, hey, well, I can do the billing. Let me just take that over. Well, after about a week, she said, no, thank you. It's not as easy as she thought, at least with the system that they were using.
Sure.
So what did they do? She and her partner did what she recommends all doctors do if they want to be successful in their own private practice. And that's outsource the billing to a company like one of our licensees. So publishing these books with Dr. Vicki allows you to have your name connected to her. Now, let me show you this one, because I think, Eric, I don't know if this is going to show up or not with this virtual background throws this thing off. Yeah. Can I reveal my true background here?
Sure, why not?
Okay, here it is. This is what I'm really sitting in front of. And you folks are going to be surprised that it's not as fancy an office as you see right here. In fact, it's pretty plain looking. Yeah?
There you go.
What is that? Oh, that's it. Okay, so here's the book. I wanted to hold it up so you could see it, but Eric, maybe you could stop showing the slide just for a second.
Yeah, absolutely. We'll go bigger.
There you go. Look at that.
Yep.
This is the one that Adam just wrote, and we published this just a couple of months ago from him and Dr. Vicki Ragnar. Now, this is a paperback book. You can get it on Amazon for $24.95, but folks, we supply a number of these to you in your package, and then you can reorder them at our cost, which is under $5 a book. That's pretty cheap for a marketing piece. And look, Absolutely. What we did is we came up with a way for you to put your name, your company name, your email address, or your web address and your phone number right there on the book itself. So when the doctor gets this book, we teach you how to get this doctor in the doctor's hands. He or she looks through it because of the little tabs and reads that each one of those tabs has a highlighted section to it. In other words, we've taken and we've highlighted phrases and paragraphs in the book for them to read. Plus, they see that they see that it's from you, and they leave it right there on their desk, and your name is right there in front of it. It's a great marketing piece.
And that kind of goes right along with the question that is from Chitty here. And the question is, there are so many billing companies in my area. That's my biggest fear in starting this business. Well, you know, whether it's medical billing or whether it is a restaurant or whether it is a convenience store, you know, you're always going to find other people in that area. You know, I bet you if you drove down the street, you're probably going to find a new insurance company that just popped up. Well, yeah. Believe me, that was in the back of their minds as well. There has to be way too many insurance companies that are in my area. This is a personal relationship and what you're actually can be able to do with doctors. And believe me, just like Dr. Vicki Ragnar, she was actually looking for a medical billing company.
Yeah. In fact, we're going to show you how to find where doctors advertise that they're looking for medical billing people. That's right. They
Absolutely.
actually advertise for medical billing
That's
companies.
true. Can't
And
give that secret away though, Patrick. That cost them $28,990.
that's right. We got to hold that back. Okay. Well, that's just one of the books. There's another one there called The New Thriving Practice, Medical Practice. I wrote this myself with Dr. Vicki Ragnar. And as you can see on this one, we allow you to print your name right on the front cover of the book. See it there? It says forward by Susan Smith or whoever. The point is your name would be right there because we have a forward that we can put your name on the front of it, or you can write your own.
There you go. All right. Why don't doctors just do the billing themselves? And what's the ABS advantage? This is a great question here. Patrick, I wanted to first put this up there. You and I found this quote together. 2 out of 3 doctors say they are just squeaking by or in the red financially.
You'd be surprised how true that is now, Eric. I think we found that quote even before the pandemic. And now, of course, it's even more dire for doctors in private practice. They're struggling financially, folks. And that's why, even though, yes, they could do it themselves, it's going to cost them more money. We'll show you a little chart here that illustrates that here in just a second.
And you know, the New England Journal of Medicine, and some of you have been on some other webinars, you've probably seen us talk about this, but this is expensive. And so when doctors are doing billing in their shop, in their office, their practice, it literally costs them 24 cents or 24% of what they're getting versus, remember, I said 7%. So you do the math. And if you'll get with your rep, they can actually walk you through a scenario of how to do a practice analysis and then practice analysis report. And you'll get to see, you know, those that are maybe a little bit in fear of selling, you're going to find out that you're really not selling. You are really helping that doctor. But Patrick, here's that chart that you wanted to kind of talk about there real quickly.
Yeah. So here's a comparison between in-house and outsourced billing. Now, remember, outsourced means they would send it to you and you would do the billing for the doctor. So as you can see, based on the numbers that we have right here, which is just 400 claims a month, that's 100 a week, that's 20 a day, times 12 months at about $100 a piece. And we're just using 6% here.
Right.
That's just $28,800 that the doctor would pay you to do the billing. But if they do it themselves, look at all these costs that they've got here. These are all hidden costs that most people don't even know about.
Right.
And so as you can see, the bottom line is you could either let the doctor spend $65,000 or they could spend $28,800 with you and have it done and get rid of all the headaches and reallocate the people in their office who are doing the billing now to help them see more patients and, you know, provide better service to the patients.
Absolutely.
It's a win-win for everybody.
It is a win-win. Another question's come in. I've heard in previous webinars and YouTube interviews that dental billing is not lucrative as dentist. Dental billing is not as lucrative. Dentists don't see that many patients, but I've seen that my doctor's office see more patients and perform more procedures than primary care doctors and specialists. Could you please elaborate why dental offices are not recommended? We're not saying that it's not recommended, but if we used to have this chart that showed all of the medical revenue money that's out there. Obviously, a big chunk of it was hospitals. Then it kind of broke down in the next biggest pie of that chart were physicians and surgeons and stuff like that. And only a very small piece, I think it was like 4% of all of the money that's out there in what you think of as medical money, only 4% of that was actually dental billing.
Yeah, and so we did do some research ourselves as a company. We found out that there is a decent enough market in the dental arena for us to justify putting that as a part of our package. And so we added that last year to our package. Now, that doesn't mean you should go off and just start signing up dentists first thing, because there's more doctors than there are dentists in your area.
That's correct.
But if you have a personal relationship with a dentist, or no one, like Chitty says they do, that sees more patients than doctors do, then hey, I would go
Sure.
approach them first. Yeah.
Absolutely. Folks, what you can see here is what ABS has done. It's given you a lot of different options.
Right.
If you go with one place, maybe the only option is just do medical billing. We give you more than just the option just to do medical billing. And talking about the advantage of ABS, we've kind of talked about that, and Patrick kind of briefly mentioned here just a moment ago. Really, what makes ABS different with the software is that this one right here. I know that we're going to get short on time, but we want to make sure we get to all of our questions here. But no other billing system has their own built-in clearinghouse. Now, today, if you're not sure what a clearinghouse is, again, just mark that down on your notes. Go back to your ABS rep, and they will help you understand what a clearinghouse is, because it's so vitally important in your billing. But most of the times, what you're going to find with other billing systems, and this kind of goes to Chitty's question earlier, there's so many billing companies out there. Why would they even look at me? This is that advantage right there. And you can see we've kind of illustrated it here in this little one illustration. The clearinghouse is literally built inside of the billing system that allows you to go directly to the insurance companies instead of going outside of a system, going to a clearinghouse, and then the insurance companies. This is a huge advantage. And as Patrick mentioned earlier, this is how we keep the rejections so low, below 2%, and then getting these doctors paid within a week's time. That's incredible.
Yeah, a clearinghouse is a third party, another separate company. And some companies tell you got to go out, find your own clearinghouse. And how do you do that, folks? If you haven't got any background in this business, you don't know what's a good clearinghouse and what's not.
Right.
And by the time you figure out which one's going to give you the best service for your clients and so forth, you will have spent hundreds of hours going through all the different options that are out there. We've decided many years ago to build this into our system so that if a claim does not get cleared, if it doesn't go through, it's our fault.
Absolutely.
We're not going to pass that off to any third-party company.
Absolutely.
And that's why our rejection rate is less than 2%.
Patrick, here's a great question. What if the United States changes to a single-payer healthcare system? Now, let's see. I've been with you for 15 years. I think I've heard this every year for the last 15 years.
Yeah, we get that asked a lot over the years. I think in the back of everybody's minds, they know that there are some people in government and just individuals who want the single payer healthcare system because they think that'll be better for patients. Now, I'm not going to argue one way or the other. I'm just saying it's probably not going to happen anytime soon. Even if it did, there are papers out like this one, which we'll be glad to send to you, on the 20 myths about single payer health insurance. Folks, it is a myth that it would be cheaper, better, faster, more efficient, et cetera, et cetera. Now, let me tell you how I can prove that, by the way. By the way, just ask your ABS rep for the 20 myths document, and they can send that to you. It's about 15, 20 pages long. So it's a good little study on this subject. But here's why I know, Eric, that it's not going to be a problem. There are billing companies in Canada. Yeah, we went out and found these on the web. In fact, there's a link right there at the bottom of that page. If you want to ask your rep for a printout of these slides, you can zoom in on that and see what that link is there. But the point is, there are dozens of billing companies in Canada. You see it right there.
Right.
But these are the top, I think there's 20 or so on this page of the companies in Canada. So here's why. Yes, Canada is a single payer system, but that means that they're going to send the claim to some division of the government. There are different departments that they have to bill to. So the doctors still have to make choices about that. They still have to make choices about their own codes, even though they use different codes than we do. All kinds of stuff is different about it. But the point is that doctors would rather outsource it to somebody else, even in a single payer system, because it's too big a hassle, and they'll make bottom line more money.
Absolutely. And folks, I want you to think about it. I mean, we still have some liberties here in the United States, which is fine. But think about the big companies that are out there that actually do all of the lobbying in Washington, D.C. Folks like, let's see, Aetna, Blue Cross Blue Shield, Cigna. I mean, you're getting the drift here. I mean, these are large companies, and believe me, they are lobbying to their senator or House of Representative there to say there is no way in God's green earth are you going to switch over to a single payer. There's just way too much money to be made by these insurance companies. So
Yeah,
that's
what it boils down to. Yeah, follow the money. Hey,
follow the money.
Just look at your downtown area. In your downtown area, which buildings are the tallest and the biggest and the most expensive? They're all owned by the insurance companies.
Absolutely. They're out there and they're still there. All right, Patrick, is the iClaim software the best on the market? Well, I think we've already made that point to some degree.
These 5 dogs say that it is the best. And I don't know if you take the word of dogs or not, but that's clever, isn't it? The best of breed. In fact, you see those two little symbols there, those little logos by class. This is an organization, folks, that rates different companies, and they found out which company had the best practice management system on the market. That's us. Yeah, and it's the #1 small practice system as well. So we not only have the largest and the #1 best big system, we have the one for smaller doctors. Like, that's generally what our market is the 1 to 10 doctors.
Absolutely. Yeah. So it is. And then you can go out there to class, go check them out and see what they're all about. We've got that there. And I think if you'd like to, you can get a printout of this from your ABS rep sometime in the next couple of days. We'll make sure that's there.
Well, and this next slide shows, Eric, in summation, there are 10 things that separate us from the other software that's out there. So if you want to know that for sure, you need to go and ask your ABS rep to see a demo of the software. Once you see it, you will be blown away, just like the doctors are.
You bet. How hard is it to learn how to file claims? Now, Patrick, you and I've done webinars on this. How much experience do I need to even get in to do medical billing? And this slide really kind of tells it all.
Yes, it's all done through training, folks. We start you with 10 modules, each about 90 minutes in length, and they're done virtually over the internet, of course, with a live instructor. So you and one other person, the instructor, is on the training. Well, you could have your spouse or partner sit in on it as well. But anyway, the point is, you don't have a whole classroom of people. It starts with that one person teaching you exactly how to file your first claim. And once you see that, and then all the videos that we have available on step-by-step how to file those claims, Eric, I would say the average person might take a half hour to learn the details of it. And then once they file their first claim, what would it take them? Maybe 5 minutes?
Yep, absolutely. I mean, you're actually going to go in hands-on training on iClaim and EMRX. You're going to be given exercises, homework to do. So like, let's say that you were meeting with Patrick or me or one of the other trainers, we would teach you how to do it. It would give you homework work that you would come in the next training that we go through. We're actually going to go through it with you to make sure that you've got that done. Plus, we've got a complete marketing billing support. You see that right there in the middle, and ABS network support. So folks, you're not just left out there by yourself. You've got a complete team behind you to help you with all of that.
Yeah, Eric, I don't think we have a picture in this particular webinar, but sometimes we show a picture of some of our support team out in California. We have probably over 100 people who are part of our technology partners that can support our licensees from coast to coast. So we literally have people from California to Florida to New York to Texas.
Yes, don't forget Texas. Come on.
Right.
So does ABS have a marketing territory?
It sure does. In fact, it's shown right there on that slide.
We just moved it up. We just moved it out of the way.
That's right. It's the whole United States. Folks, there are no territorial limits. You can do billing with just our certification. Remember, you just register your company in your own city, and then you get our certification, which gives you nationwide ability to file claims nationwide for any type of doctor that's currently filing with Medicare or insurance companies.
Absolutely.
And so there's no territories. You want that because You don't want a doctor that you sign up here locally to say, hey, I know a doctor in California. Do you want to do his billing? And you go, oh, sorry, no, I can't do that. It's outside my territory. We don't do that. We don't limit you.
And so this is also a good point to make. You may live in an area, like an area, let's say Dallas or Fort Worth, because that's where we are. And you may find out that there's other ABS licensees in that particular area. You don't have to worry about them thinking that you thinking that they are your competition. Because remember, I may be in Dallas or Fort Worth. I may be doing billing, but like Patrick said, I may be doing billing for doctors in Florida.
Right.
So am I really your competition here in the Dallas Fort Worth area? And see, I think that's Chitty. I think that's one of the things that you have to think about when asking that question. There seems to be a lot of medical billing people in your area, but remember, they may be doing billing for doctors in Tennessee, not necessarily in your hometown. So keep that in mind as you're thinking about that.
Yeah. In fact, that's the next question here about competition. We touched on that earlier, but folks, with our technology, we blow out the competition. That's a good way to put it, Eric.
Yes.
Because in the technology, look, you can see the doctor holding their little, looks like a mini iPad there. But the point is, it runs on any platform, any device, any tablet, any laptop. It doesn't matter the operating system. This is all in the cloud. So you literally, as long as you can connect to the internet and go through a browser, you can connect and start using our system. He's showing here that the doctor uses the electronic medical record system that we have when they are seeing the patient. I mean, right in front of the patient, they can be holding that in front of them, tapping the things that pertain to that particular visit. It is fantastic. It will blow you away, just like it does the doctors when they see the demos.
And that's what I was going to say. I think the best thing to do is, if you think about it from start to finish, if you're trying to think about, if I get involved with ABS, what's my first hurdle? What's my first goal that I need to get to? I would say if you can get in front of some doctors, we're going to teach you how to get in front of these doctors. And as Patrick said, we're going to show you where doctors are advertising, where they're actually looking for a medical biller. We can show that to you, but your goal is not to necessarily sell them on you just yet. Get them to a live demonstration. That's all done by doing that practice analysis and then showing them what they get, and then just get them to a demo. Here is where we blow out the competition, because there's nobody else in a business opportunity or a marketing franchise business that will take the time and do the demonstration of the software based on the numbers that you collect from that doctor. And that's where, Patrick, that's where we're blowing out the competition. That's how we're winning business for our new ABS licensees.
Yeah, so let this sink in just for a second, folks. First of all, we'll do a live demo for you, one-on-one. Ask your ABS rep. They'll set up a time using Zoom or something like this, where they can actually show you our system in real time, running over the internet, just like you would see it if you were actually doing the billing for a doctor. And that way you can ask questions. You can ask about the different things you see on the screen there.
Yep.
It's a terrific way to learn what the system's all about. Then once you're out marketing to doctors, you can also ask us to do the demo for your prospective clients. That's right. Our demo people will set it up with you, of course, on there as well. So you can hear everything that's said, all the questions that are asked by the doctor, and we answer all their questions. Eric, that's why we're closing about 50% of all of the doctors who see these demos by our demo people.
Absolutely.
So it's very powerful. Yeah.
That's why I say just make your first goal of just getting doctors, as many doctors as you can, just to the demonstrations. Because if you can get them to there, we're going to figure out a way to get those closed for you. Patrick, there's a great question here. Can I run my business from home, or do I need an office?
Now that's the way to run a business right there. You see how
relaxed
that guy is?
That's exactly how you run the business.
Back using his laptop. Yes, in fact, it's your choice. You can pick to do it from your home, which I'd say, Eric, 95% maybe of our licensees never open a commercial office of any kind. Those who do want to build this thing really big, they want to hire people, they want to build it, and for $400, $500, $600, you can have a little office and put people in there doing all the work for you. You can manage them that way very carefully, or you can hire people who can do this from their home as well. Remember, you can manage people virtually now over the
Yes.
internet. You don't have to be sitting right next to them to watch what they're doing. And it's a great way to run a business. Either way, it's your choice to do that. We have
Absolutely.
licensees who do both.
Yeah, but I prefer this.
That's about as laid back as it gets.
I love that picture. All right, I think we're getting close to some of our ending of our questions, but this is a great question. What is the demand and growth potential for the medical billing industry? Patrick, I'm going to put this slide up here for you can kind of talk through this one.
Yes, this is the U.S. revenue cycle management market. Now, folks, that's what we call medical billing. You're managing the revenue cycle of a doctor's office. And as you can see, it can get very, very exciting when you start doing that because, as you can see, this was for 2021. The report said that the doctors would do $136 billion. Look at what is projected, Eric, for 2028. What is that?
Right.
6 years from now, right?
Right.
$286 billion industry. That's a growth of 11.2% in the next 6 years. I just think that should blow people away. If you're looking to get into business, this is a good market to be in for sure.
You bet. Yeah. And the reason that, companies like this U.S. revenue cycle management market company that puts these reports out, the reason it's kind of a year behind, they got to capture all that data from last year. So that one will be coming out projecting what's going to happen in the next 10 years from now. But this is good information to find out if there's actually a market for that. All right, Patrick, as we're again wrapping up, I think this is our last 10 of our 10 questions here. Why would a doctor trust me to do their billing? That's really, really what it comes down to.
Well, it involves, of course, the certification that you'll get from the Medical Revenue Management Association, but we also connect you with Dr. Vicki Ratner, who we mentioned earlier, and let you partner with her. So she'll write a letter of introduction from her on her letterhead for you and your company in your area. And that's one of the reasons that doctors do business with our licensees, is because they trust another doctor. And when Dr. Vicki says this person is a part of the nation's largest network of medical billers, they have a lot of resources behind them. And the company itself, the network, has done thousands of claims for hundreds of doctors from coast to coast. That gives the doctor the assurance that they should be able to outsource it to you with no problem.
Absolutely. Well, folks, we want to start wrapping up here. We've got about a little over 6 minutes here. Chitty's got one more question here before we kind of start going down with some other final questions. And so if anybody else would like to ask a question, you may. I think this is kind of on the quote, in-house billing challenges slide, end quote. Setup fees and monthly fees for the software that is charged to the providers is not included. That will increase the total cost of the providers. Sorry, it may sound like I'm asking questions like a provider. Are you a provider? Maybe you are. Maybe you're trying to get started yourself. That Patrick, I think, let me go back. Let me find that slide so we can kind of look at that together. Let me just
it's 34.
Yep, there we go.
There you go. Now look, there are setup fees, there are training costs, there are all kinds of fees involved in this that the doctor may or may not have. So even though we came up with $65,000 to do it in-house, if they had fees for us and for our people, for you to hook up with the clearinghouses and the insurance companies, it wouldn't be another, 30, I don't know, maybe $200 or $300 a month. So it's not going to be that big a difference. And the point is that sometimes licensees wrap those fees right into their percentage, and instead of charging 6%, they charge 7 or 8 even.
Right. Yeah. That's all you do. All right, we're going to ask one last time. We're about to close this thing down. Any other questions? If not, we're going to go to the next thing on how to get started. But before we get to that, Patrick, why don't you talk about your money back guarantee and how that works, and then we'll get into these next steps here.
Eric, I can't tell you how many emails I get about different business opportunities usually scam type stuff on the internet, how to build a drop shipping business or
Right.
something to do with Amazon, selling books or whatever. And I can tell you that I have actually purchased some of those. Now, my mistake was that I didn't look carefully to see that they had a money back guarantee. So once I'd spent that, $100, $300, whatever it was, I didn't have any way to get back. I would not buy a franchise or a business opportunity, a license agreement like we have from anybody without a money back guarantee, because I don't really know.
Right.
You don't know. The
Right.
people on this webinar don't know whether or not we really are saying the truth here. They wouldn't know unless they went through our training and saw kind of behind the curtain, everything. Once you've gone through our training, and in the first 30 days, if for any reason you don't like anything that you see, you just ask for your money back. I would rather do that, Eric, and give money back from time to time than to have people go through and then be disappointed that it's not what we said it was going to be. Now, that has happened, as you know, Eric, over the years. We've given back a few people their money back, but it's not like it's like 0.5% or something. It's so small that it really doesn't count. So that's a good assurance, though, folks. Don't invest with a company unless they tell you that they would give you their money back, even if you've gone through their training.
Yeah. Again, I'm going to say it as Patrick would say, let that sink in for a moment. You're going to go through all of the training, all of the secrets, all the trade secrets. You're going to learn all of that. And you can still have the opportunity to get your money back. There's no other company that would even dare do that.
No.
And I say dare do that because they're probably very unsure about their business model. ABS is very sure. They would rather work with smaller groups of people than a whole bunch of people and then get bad press anywhere. So that's why Patrick
in today's world, Eric, you better do what you say you're going to do. It'll be all over the internet. And as you know,
that is true.
Reviews from people who've been through our training. We have reviews out there on Google and Facebook and other places that are from people who've gone through our training, and the reviews are all 4.5 stars, Right. Okay.
Yeah. All right, let's talk about these next steps here. Let's get these next steps. The first step is research guide. Patrick, do you have a copy of your research guide there handy?
I do. Somewhere.
I caught him off guard.
And I promise I'm going to find it. Now, I don't know how to show this though, Eric, because you have control there.
Oh, hey, I'll stop showing and then let you share yours.
All right, let's see if I can share this right here. This is the document itself.
Yep, there you go. Yeah, we see it.
I've actually opened it up. This is the first time I've done this, I think, Eric. I've never shown the actual document, but there it is. And as you can see, it has great information in it. No, here's the table of contents. And folks, all of these, this is a PDF file, but you can click on any one of these and go straight to them. So if I want to see the professional marketing materials, I click on that. And as you can see, it starts showing me everything about the marketing materials. These are the websites that you have available to you. And then there's all the books and postcards and flyers and other materials that you have. Eric, this is 65 pages now, and it goes into detail. I mean, real detail about all this. Here's the what they call a contact sheet. So there's all 65 pages. If you can zoom in on that and read it, you don't have to order that from your rep.
Yeah,
I would recommend that you do that. There, I'll go back to you, Eric.
Okay. All right, let me share this other part over here. So that's the research guide, folks. I can go grab that. Browse our YouTube channel. I mean, Patrick, between you and I, Jason and Adam and Dr. Rackner, and then all of your interviews that you've done with licensees, what do we have? A kabillion videos out there?
Oh, it's dozens and dozens of them. Yeah. So folks, just go to youtube.com/whyabs, and you'll be able to browse that channel. Just take a look at some of those. Yeah.
Yeah. You can't do this without a reference list. You got to get a reference list, folks. And that's the ABS licensees. Talk with people, as Patrick would do me. Patrick may be full of smoke right now. And so you go talk to people that are, that are actually doing this, and besides just Patrick and me. We know that you trust us, right? I mean, we're here every week.
So the last 10 years, yeah.
Yes, yeah. So go talk to those licensees. Patrick, you've already talked about a demo.
Eric, I'm just asking this question because I I didn't see the little blurb up here under the ABS licensee references. Did we just go past that fast?
I thought I didn't see that too. I may have to fix that and add it into next week. So I'll make
Okay.
sure it gets there.
All right. I thought I was going crazy there. Yes.
Nope.
The demo. Just go back to your ABS rep and say, hey, I want to see a demo of the system itself. Then you get to ask all the questions you want about, how easy is it to use, and does it have all the update codes? And it's just it's an essential thing for you to do. And then you can ask your ABS rep for the purchase agreement and the funding instructions. They'll send that to you by email. And as soon as you get that and read it over and sign it and send in your funds, then you just get with your trainer. We'll actually hook you up with the person who's going to do your training and let you guys work out your schedule, because we train according to your schedule, not ours.
You bet. All right, folks, well, give us a call here at 866-565-8413. Or if you don't know who you're supposed to be talking to, type in info@absystems.com. Drop us an email. We'd love to talk with you. Somebody, I promise you, will answer that email or that telephone number. So give us a shout here. We'd love to be able to chat with you. Patrick.